Traumatic brain injury is a very important challenge in intensive care. Managing these patients often becomes very difficult. The Brain Trauma Foundation guidelines form the basis on which experts across the world treat this group of patients. If you look at the evidence, you would know that the only level 1 evidence actually is not to use corticosteroids in TBI. And this comes from the MRC crash trial, which was published in 2005. 10,000 odd patients, clearly showing a mortality increase in the steroid group. Before 2005, there was some renewed interest, especially with the steroids in spinal cord trial, the Access 2 trial, which actually showed a promising results with the use of methylprednisolone in traumatic spinal injury. And that was sort of correlated that it might work in traumatic brain injury as well. But clearly, the 2005 evidence was against the favor of steroids. Come 2021-22, there is a renewed interest for steroids in traumatic brain injury. And this comes from one study which actually looked at retrospective analysis of patients who were given steroids. Now, what was different in this trial as opposed to the crash trial? Of course, it was a retrospective trial, so obviously the level of evidence can't be that high. However, what was important is that they did not give steroids from day one. The timing of the steroids was different. They sort of looked at giving steroids to patients who had mild to moderate head injury at around day 6, day 7. And the mean duration of dexamethasone which was used in this trial was around 6.5, 6.6 days. And the increase in the outcomes, the beneficial outcomes, improved neurological outcomes was definitely seen in the steroid groups. So I think it's time to revisit corticosteroids in traumatic brain injury. And perhaps it is the timing which is important. And you would see more and more trials coming out. So I don't think steroids have had the final say as far as the traumatic brain injury goes. We still have a divided opinion. On one end, you have the crash trial, which actually is an evidence-based trial, which has got very high number of patients, well-constructed, well-structured trial, where the retrospective trial, which is hinting towards the signal that perhaps if you change the timing of steroids when you give it, you may have a beneficial outcome. More to come on this point. Thank you.